When care or help is initially suggested or mentioned, the suggestion is usually ignored. Sometimes a watchful neighbor or a helpful friend makes the suggestion. Other times a suggestion is made by a doctor or adult children. The idea of needing to do anything is more often perceived as a negative, especially to the person to whom the suggestion is made. No one wants to have to need to do anything, especially anything we are told by another person. Doctors suggest exercise and weight loss. Patients ignore the doctor's suggestions. Medication bottles provide directions for taking medications. Consumers ignore the directions, failing to take medications as prescribed. Diverting for a moment on this subject, the number one reason older adults are admitted to hospital emergency rooms is because they fail to take medications as prescribed. If you believe that ignoring the instructions on medication bottles and taking medications on your own schedule is good practice, I will tell you that you are placing your health at risk. Many individuals know what should be done to maintain their health, to save for retirement, to accomplish other goals in life. Few individuals succeed in accomplishing their to-do lists. Failure happens not always because of a lack of desire, but more due to a lack of action and direction. Failure happens not from having a clear understanding how to progress from A to B to C, from not having a recipe to follow. Simple question: are you able to bake a cake without a recipe or directions? Some of you, yes. Most of you, no. When the subject of needing care is proposed, action is not taken for the same reason. A doctor or other person mentions care, but fails to explain the exact type of care, why the care is beneficial, the costs of care, who will provide the care, and the consequences that will occur if care is not acted upon. A simple suggestion without specific details and a step-by-step action plan usually fails. If a doctor tells you that your refusal of care will guarantee that you will die a painful death in 3 days, will you refuse care? You might, if you didn't believe your doctor, but most reasonable people, believing the doctor's prescription to be true, will accept care. You as the person for whom care is recommended, or for the caregiver of a person needing care, bear the burden of asking questions so that you can make a recipe for success. Begin by asking, what are the benefits of care? Exactly what type of care is needed? What is the cost of care? Who provides this type of care? And if I refuse care, what are the consequences? Knowing this will allow you to take the next step to disagree with the recommendation or to agree and then determine next steps to obtaining beneficial care. I'm Pamela Wilson of the Caring Generation, an online community of support for family and professional caregivers.